Hi, I'm Virginia. I've been a registered UK pharmacist since 2014, and today we are talking about diving. So I've brought in an expert who is Debora. Debora, would you like to introduce yourself?
Hello, thank you for having me. First of all, I am Debora Podesta. I am a medical doctor based in Italy. I am actually specialized in infectious diseases, but I also hold a master's degree in hyperbaric and underwater medicine because I am a certified diver and this is a passion of mine.
Perfect. I love that. Thank you so much for being here today.
Thank you for having me.
All right, so let's get started with the first question. So, what is the difference between diving and scuba diving?
In recreational diving, there are two types of diving. The first one is free diving, and in this case, the diver just hold his breath and dives. And the second one is scuba diving. Scuba stands for self-contained underwater breathing apparatus, and in this case, the diver has all he needs to breathe underwater and to stay underwater for a certain amount of time, an extended amount of time, and he is free to move without being connected to the surface.
Okay, brilliant. That's really interesting to know. So, who are types of people that should not go diving?
The evaluation should be medical and should be on a case-by-case basis. There is not an upper age limit for scuba diving, but people can have a certificate starting from the age of 10. And of course, generally, nobody should dive while feeling sick for any reasons, of course. These may seem obvious, but often divers try to go for the dive anyway because they maybe want to enjoy the holiday. So put themselves in maybe a risky situation. I would say that nobody should go diving without a recent, within a year, and updated medical evaluation and consent. There are many diseases or conditions that put divers at risk for their health. So cardiovascular diseases, pulmonary, or conditions that put at risk of loss of consciousness during a dive, such as epilepsy, hypoglycemia, or cardiac arrhythmias. So, a physician should evaluate it. And there's also a medical questionnaire that is useful to understand if the person needs a specialistic evaluation. Finally, I would say that pregnant women should avoid diving, and also women trying to get pregnant.
Hey, thank you for that. Really helpful. And so, why do people pee so much after diving or scuba diving?
Yeah, this phenomenon is called immersion diuresis and is caused by two factors, actually. The first one is the pressure that the human body experiences underwater, which counteracts the normal gravity-related blood pooling in the legs, especially. And this causes a blood shift from the peripheral veins, especially in the legs, toward the chest. And this is interpreted by the body as a fluid overload, which enhances the diuresis, so the urine production. Also the cold, so the cold of the water causes vasoconstriction in the legs. And this is another factor that contributes to this blood shift towards the chest.
Brilliant. Thank you for answering that. So, why do divers enter the water backwards?
Well, actually, this is one of the possible techniques used by divers to enter the water, and this is called the back roll entry. In this case, the diver is seated on the edge of a small inflatable boat, usually, and just rolls backwards into the water. And it is better than the head first dive because in the latter case, there's the risk that when the divers enter the water, could have some sort of trauma in the face due to the equipment there. And also the mask and the regulator could be dislodged and the diver could lose, for example, the mask. Other common water entries are the so-called giant stride entry. In this case, the diver is fully equipped and stands at the stern of a boat with a mask on, the regulator on, and keeping his equipment safe with the hands, just makes a large step forward and falls into the water. The last one is the shore entry. In this case, he is fully equipped and just simply walks into the water.
Okay, awesome. So what should you not do before diving?
In general, there are some behaviors that should be avoided that put the diver at risk of dehydration, some diseases, for example, decompression sickness or anxiety and panic attacks, hypoglycemia, or low consciousness or alertness. So I would say avoid drinking alcohol or doing drugs, of course, or put yourself in situations where you could become dehydrated. For example, saunas, long sun baths, hot tubs, stuff like that. Avoid sleep deprivation or the use of some medications such as sleeping pills, anxiolytics, or drugs, as I said before. You should avoid fasting, but not eat too much, of course. And also avoid physical exercise that could induce dehydration, but also increase the risk of decompression sickness. Another hazardous practice is the use of decongestionant nasal sprays. And it's not that uncommon that divers do use them, but it's risky because the action of this medication is pretty short and could stop while the diver is underwater and cause even a rebound effect that may cause some difficulties for the diver during the ascent phase for the ear equalization.
Oh, that's really interesting to know. I didn't know that decongestant nasal sprays could have that effect. So what should you not do after diving?
Again, hydration is key. So you should avoid not drinking water. So also the consumption of alcohol, or again, the behaviors that put you at risk of dehydration, and also physical exercises for the same reasons I said before. Another important thing to know is that it's good to wait a certain amount of time before traveling to high altitudes or taking a flight soon after a dive, because this is a behavior that puts at risk, again, of decompression sickness.
Okay, interesting. So what is diver's mouth syndrome?
Generally, with diver's mouth syndrome, we talk about an acute dysfunction of this joint right here, which is called the temporomandibular joint, and is caused by the fact that the divers underwater keep the regulator and the regulator mouthpiece inside their mouth. And often, mainly if they are stressed, anxious, or because of the cold, they grip it too tightly. And this could cause jaw pain, headaches, and the clicking of the joint. Also, the regulator is made of plastic, rigid plastic, and this could cause some irritation or sores in the gums. Another possible symptoms that the divers experience after or during a dive is pain in one or more teeth due to the presence of some air inside of the tooth. Maybe because he has defective filling, untreated cavity, or an abscess, a root canal abscess. And the air for the changes that of the environmental pressure tend to cause a vacuum effect or expand. And this may cause pain and sometimes even the break of the tooth or the explosion of the tooth.
Is getting the bends painful?
The bends is an historical and colloquial name for a type of decompression sickness, also called the Casson's disease, and derives from the fact that back in the 19th century, during the construction of major engineering and waterworks, such as the Brooklyn Bridge in New York City. Workers operated inside pressurized underwater chambers that were called caissons. After the work, they may come back to the surface too rapidly and experience some severe joint and muscles pain, especially in the shoulders, elbows, and knees. And so instinctively bend forward to relieve discomfort. So this is where the bends comes from. After some periods, scientists understood that this is a form, the musculoskeletal form of decompression sickness, which is caused by gas bubbles inside tissues.
Okay, that's really interesting. Thank you for explaining. So, how can you make your lungs stronger for swimming?
There is not a way to make lungs stronger, but surely you want to avoid harmful behaviors such as smoking. And surely you should never hold your breath during the dive, especially in the ascent phase, but it's true for every phase of the dive. But during the ascent phase, the air, the gases inside your lungs tend to expand because the environmental pressure decreases. And if the gas cannot find a way to exit the lungs, could cause some damage in the lungs, even break the lungs and enter the circulation. And this phenomenon is called arterial gas embolism. The gas could also reach the mediastinum space, the pleural space, and the skin, even causing pneumomediastinum, pneumothorax, and subcutaneous emphysema. It's very dangerous.
So then the technique for diving is that you have as much air as possible in your lungs and then you're just slowly releasing it when you're diving.
Yeah, exactly. Continue breathing in a gentle way and never hold your breath.
Okay, that's great. So what are the most common side effects of diving?
I would say it is the so-called middle ear barotrauma. Just to explain, the ear is divided in external ear, which is in contact with the environment, the middle ear, and the internal ear. Between the external and the middle ear, there is the eardrum. And between the middle ear and the internal ear, there are two little membranes, which are called the round and the oval membranes. The middle ear is connected to the upper part of the pharynx through a small canal, which is called the Eustachian tube. And the middle ear is filled with air. So these air changes in volume at the changes of the pressure environment. So if the air cannot equalize in pressure with the environment, this could cause some damages to the middle ear, pain, inflammation, bloody ear, or also the rupture of the eardrum in the more severe cases. The tube may not be able to open because it's normally closed, but can open sometimes thanks to the contraction of some muscles. But in case of a cold, nasal congestion, mucus, rhinitis, the tube couldn't be able to open. And so the middle ear becomes a closed cavity filled with air.
And we want to avoid that. So we need
Yeah.
the air to be able to escape. Great.
Mhm.
Thank you for explaining that. So you mentioned that you can't deep dive if you're pregnant and you should avoid scuba diving close to flying. And is that because of the changes in air pressure?
Yeah, for the flight, what it's important to understand is that during the dive, we said that the deeper the diver goes, the higher the environmental pressure. And The higher the environmental pressure, the higher the amount of nitrogen dissolved in the tissues, in circulation, in the blood, and in the organs. And during the ascent phase of the dive, if the nitrogen doesn't have enough time to be eliminated through breath, it can cause some bubbles inside the blood, inside the tissues. And this is at the base of decompression sickness. This disease could also appear in case the diver doesn't wait enough time to let the nitrogen be eliminated through breathing. And so taking a flight soon after a dive could be a cause of decompression sickness.
And what are the symptoms of decompression sickness?
There are different types based on the organ which is involved. We talked before about the musculoskeletal one, but symptoms may develop in the skin with itching or rash, or, for example, in the brain, you could lose consciousness or having convulsions, blindness even. The spine cord may be involved, and this could cause severe pain in the back or paralysis even. Sides of decompression sickness are lungs, so you may develop cough and short of breath, or circulation with collapse. So some types are mild or moderate, but some could be very severe and even life-threatening.
Yeah, and this is in addition to you mentioned musculoskeletal symptoms, which is pain in your joints, so shoulders, elbows, knees, and that's because of the bubbles.
Mm-hmm. Exactly.
Okay, great. Thank you. So why do divers shower after every dive?
The reasons are, of course, for salt removal and to avoid dryness, irritation, and itching of the skin, but also for equipment care. So you want to clear all your equipment, so the wetsuit, masks, regulators, zippers, from salt, sand, and microorganisms. And this helps prevent corrosion and prolongs equipment life. And also for self-hygiene and comfort, by showering, you remove the sweat, bacteria, sunscreen residue, or marine particles from the skin and the equipment, as we said.
Does it help to bring the body temperature back to normal as well? Because when you dive, it's really, really cold.
Usually divers use cold water to shower. If the diver feels very cold, could decide to have a warm shower. Yeah, but it's not always the case.
All right, cool. So how do you avoid ear pressure when diving?
So to avoid the consequences of pressure changes, you should avoid. You should do early and frequent equalization. Even before you feel pain, you shouldn't reach the point where you feel pain in your ear, because in this case you already done some sort of damage in your ear. There are different techniques to equalize the ear. The most common and famous is the Valsalva maneuver, where you gently blow against the nose, a closed nose. But the techniques are many, and some expert divers are also able to equalize the ear by swallowing or with some movement of the jaw. So also, I would say never dive congested, for the reasons that we talked about before, and descend slowly. If it hurts, just stop. Maybe you can ascend a little bit and try again, but you should never force equalization.
Right, brilliant. Thank you so much for answering those questions. How can people get in touch with you if they want to learn more or work with you?
I would say through LinkedIn, of course, and I can give you my email. So I would say, or DM me on LinkedIn, or write me on with my email.
Okay, brilliant. So I'll link to your LinkedIn in the description box below the video and also include your email address so people can reach out to you. And thank you so much for your time today. I hope
Thank
that
you.
you enjoyed it.
It was so fun. Thank you very much. Bye bye.
Thank you. And thank you to the thank you. And thank you to the audience for watching or listening, and we'll see you in another video. Bye.